Hi, it's Dr. Robert Brueck coming to you again with another segment, What's New in Cosmetic Surgery. I want to talk to you a little bit about trends. What's trending in plastic surgery, cosmetic surgery? Last year, over $13.5 billion was spent on cosmetic surgery. Now, about 58% of that was for surgical procedures like facelifts, breast augmentations, liposuction. The remainder was non-surgical, and certainly the non-surgical in terms of number of procedures is much greater, and that involves Botox and different types of fillers. One of the interesting trends is that breast lifting or mastopexy is becoming more and more popular. It's now number 5 on the list of most common cosmetic procedures, replacing rhinoplasty. I guess it's a component, if you will, of the mommy makeover. Part of that is breast lifting / augmentation along with liposuction and tummy tuck. So breast lift is kind of coming up in terms of numbers. The top 4 procedures, number 1 was lipo. It's right up there, 1 or 2. We all have little areas of fat we don't want, and lipo is certainly one of the things that can help get rid of that fat, and I can attest to that. I've had it done. So lipo is popular. Second was breast augmentation. Again, breast aug is, I tell people, 2 procedures that I think can make a dramatic difference in a person's appearance is a blepharoplasty, upper lip bleph for men and women, and breast aug in women. It can just restore so much self-confidence and restore your feminine appeal, and it's a home run. It's a great operation. Third on the list was tummy tucks. I think we see more and more people finally coming to the realization, I got stretch marks, loose skin. Husband says, you know what, honey, do another 100 sit-ups a day, and I tell him, no, you can do 1,000 a day, and it's not going to go away. So tummy tuck is very, very popular. And the other one is eyelid surgery. As I said to you before, breast aug and eyelid surgery are 2 really remarkable procedures. If I had one procedure to do on people's face that makes a tremendous difference in their appearance, it would be an upper lid bleph. And actually, in some cases, insurance pays for it because there's a functional component. So if somebody has severe hooding, their superior field of vision is obstructed, and hence it can be kind of deadly if you're driving in a rainstorm and all the traffic lights are overhead and you don't see it. So those are some of the things that are trending. 2 procedures that are becoming very, very popular, not yet in terms of total numbers, but in terms of percentage growth from year to year in popularity. Number 1 is buttock lifting, and number 2 is fat grafting. For example, now in about 60% of my facelifts, I use some type of fat grafting. And buttock lifting, now you can lift a buttock a couple of ways. 1 is to add a person's own fat, or 2, to add an implant. I don't do implants. I don't do buttock implants. Most series show the complication rate to be between 30-35% or more. So I just don't do buttock implants. But I will do autologous fat grafting and do a buttock lift by using a patient's own fat. So percentage-wise, they're increasing tremendously. One of the big areas I see a tremendous increase is I'm utilizing fat more and more in my breast surgery, both in terms of breast augmentation, mastopexy, for example. A woman comes in, she wants to lift, wants a little more fullness, but doesn't want an implant. I'll do autologous fat. It's a great, great procedure. So those are some of the things that we see trending, if you will, in cosmetic surgery. Another thing I'd like to talk about, we've got some new fillers, some new kids in the neighborhood. They're called Volift and Vobella. They're by Allergan. And what distinguishes these 2 fillers is the fact that the cross-linking between the collagen molecules is increased, with the thought that they're going to last longer. In preliminary studies, they last over a year. They're not FDA approved yet in this country. Now, Vobella is the less substantive in that it's more liquid, flows easier, and it can be used for fine lines in the lips. Volift is more for building up, let's say, cheeks, nasolabial folds. Again, the idea is increased cross-linking, therefore they will last longer. In their preliminary studies, in excess of a year. They're in the process now of going ahead and working on FDA approval. When they become approved, I don't know. But it seems like you could open up your drawer of toys and tricks, and you might have 50 different syringes of different types of fillers. Now, how anybody can say this is better than this in this circumstance, I don't know. But again, at the end of the day, it goes to what I said before. Whatever works best in the hands of that surgeon, that's what he or she should utilize. Next thing I want to mention, a new technique for mirror dry. You know, mirror dry is a technology we incorporated into our practice maybe a year and a half ago. It got FDA approval. When we started it, people would require 2 treatments. You do a mirror dry treatment for excessive underarm sweating. The second treatment would be performed 3 months later. Now what we do is we incorporate 1 treatment. What we do is increase the energy level, and in order to increase the comfort level, because we do it as an outpatient, it takes about an hour, we utilize a tumescent technique for numbing the axillary area, and this has made a tremendous difference. And I think this is a benefit to anybody who's contemplating getting this done, because excessive underarm sweating is such a socially embarrassing moment. You can imagine a young person dating, and they're fearful of going out because they sweat and perspire so much. Maybe it's their first date, they're nervous because of that, but then on top of it, they have excessive underarm sweating or hyperhidrosis. And the other thing too is that it stains the clothes and it cannot come out. So it's really a very crippling defect that many people have. Now there's an answer. No more Botox injections every 4, 5, 6 months. Do a mirror dry. 90% of the time, 1 treatment's all that's necessary. So we do 1 treatment, we utilize a tumescent technique, and you can have it done on a Friday, take a shower the next day. Basically post-op, I give you some pain pills. Underarm ice is the most important thing. So I say to people, take a Ziploc bag, crushed ice, put one under the left arm, the right arm, watch TV, read books, do whatever to minimize the swelling. But it's a great technology called mirror dry, so check it out and see. Another thing I think was very interesting to me, years and years ago I read about silicone implants, and there have been some studies that have indicated silicone implants can lessen, you heard that correct, lessen the likelihood of women developing breast carcinoma. There was an interesting article in the Journal of Environmental International. It's not a journal I read or subscribe to, trust me, but I read about it. And what they did was they studied the silicone implants removed from different individuals who were having them removed or having them exchanged. And this was done at Oregon State University. And what they found was that in 5 out of 8 of the implants removed, they contained a breakdown product of the banned insecticide DDT. So this carcinogenic product was sequestered in the silicone of the breast implants. So then what they did was they did some studies in mice, and they put silicone discs in mice, and they noticed that indeed the silicone can draw particular toxins into the discs so they don't circulate. So this may be reason to believe that perhaps silicone implants might be a source of sequestration, if you will, of toxin, because in some studies it shows that women with silicone implants have a lower incidence of breast cancer. Now, I'm not advocating this is a preventative thing for, breast cancer, but many times women still harbor the old adage that, well, I heard silicone can cause breast cancer, and no, it does not. So in fact, it may have the counter statement of lessening the likelihood. So interesting comment, food for thought. A couple new technologies that I've incorporated in my practice I'd like to discuss with you now. One is called microneedling. And what is, a lot of women now come in and they buy these little rollers that they put on their face to stimulate their face and their complexion. Well, the device we have is a handheld battery-operated microneedling device by a company called Eclipse. And you can adjust the depth of the microneedling, 0.5 millimeters, which is what most people get when they buy one over the counter. That's all that you can do and tolerate comfortably. They can go a millimeter, millimeter and a half, 2 millimeters. Now what we do is we go ahead and put an anesthetic cream on the face, and we let that sit for 20-25 minutes, and then I do a little regional block, and then I draw off a patient's PRP, platelet-rich plasma. So then what I do is, in the platelet-rich plasma are alpha granulocytes contained in the platelets. And these have all kinds of regenerative polypeptides, angiogenesis factors, epidermal growth factors, all kinds of things that are necessary and essential to helping your tissues regenerate. So we do the microneedling after the face is prepped and numb, and then we take the PRP and I massage it in there. So we microneedle in different directions, and then we massage it in there. Sometimes I'll take a hyaluronic acid product and put that in there as well. Now what I recommend is that people don't do just one. It's not like I'm 65, I've got a Shar-Pei looking dog face, and I'm going to get rid of all my lines and wrinkles with microneedling. But it's a nice tool to have, again, utilizing your tissues to correct your deficits. So I recommend people have a series of 3 to 4. So you do a microneedling, get on a good skincare program, 8, 10, 12, 14 weeks later, do a second microneedling, and it really can enhance your complexion and help with fine lines, sun damage, brown spots. I think the combination of that with a good skincare program can really give you a good complexion. It's good for people that have acne. Again, it's not the perfect answer, but it's outpatient, simple, sweet, straightforward. And what it is, it's collagen induction therapy. And just think for a minute, as we age, what happens to our skin? We lose collagen. And that's why you see women at 20, 40, 60, 80, if they've had nothing done, their skin thins and it hangs and droops because we lose elastic fibers, we lose collagen. So every time you make a little needle prick, you're inducing the production of new collagen. So we call it collagen induction therapy. So we do that plus the PRP and sometimes hyaluronic acid liquids, put that on the face, and it really is a nice way to restore to a certain degree a complexion that's aesthetically more pleasing. So it's something, food for thought. The second piece of technology that we just got in, it's called Sculpture. S-C-U-L-P, capital S-U-R-E, Sculpture. It's a non-invasive outpatient fat melting machine. It's a laser, and what it does is there are 4 treatment heads about like this that you can place in different parts of the body. We do 4 treatments at once. It takes about 23 minutes. No injections, no downtime. Have it done. Come in at lunchtime, go back to work. And you can remove and decrease the fatty layer about 20-25%. Now, sometimes people have 2 sessions. They'll do some fat on their front, some on the back. And then after about 10-12 weeks, you can have a second treatment. Now, it's important that you come in and see me for consultation. It's free. Because one of the criteria is you got to have pinchable fat. If there's no fat there, you can't melt it. So it's important to do proper patient selection. But it's such a nice thing because there's no needling, no pre-op lab, no anesthetics involved. You come in as long as you understand the limitation. So it's a great procedure. It's called Sculpture, S-C-U-L-P, capital S-U-R-E. So think about it, come in, see us, and see if you might be a good candidate for it, because a lot of people don't want to take the time off from work. They don't have vacation time available. So this is a nice alternative so you can get rid of some of that unwanted fat coupled with diet, going to the gym, and get that new look for the summer that you've always been looking for. The other thing is, what are some of the future trends in aesthetic surgery? One of the things I've seen in my practice is that we see more and more young people coming in for non-invasive cosmetic procedures, specifically Botox. They did a survey recently, the Aesthetic Surgery Society did. 64% of cosmetic surgeons have seen an increase in young people less than 30 coming in for injectables. Now, I'm not a big fan of injectables. Many of you know that. I prefer utilizing people's own tissue, their own fat for utilizing. But one of the things I do see in my practice is more and more young people are coming in for Botox. Do I think that that's a good thing? At one time I didn't do Botox, but I do now. But I think it is. For example, we live down here, a lot of sun damage, solar damage, and by injecting Botox in select areas, you prevent the development of deeper and deeper lines and creases over the years. Again, go back to what I said earlier, that as we age, our skin thins, collagen becomes less. Consequently, it's easier to crease the skin or crease the paper, if you will. So by doing Botox, you limit that contraction, which limits the development of deeper and deeper lines. So I think it's a good thing. Another reason I think that more and more young people are coming in is social media. You know, kids are always on their phones, you know, Instagram, Telegram, thisgram, Western Uniongram, whatever. And they're sharing these things with one another. They're looking at one another. And certainly Hollywood starlets. It was kind of interesting. I was at the facial aesthetics meeting in Los Angeles not too long ago, and I may be doing a future video on that. And we went to an Italian restaurant in Beverly Hills. I was there with my son and a couple other people. And lo and behold, who did we have dinner with next to us was Khloe Kardashian and some of the Jenner girls. Of course, I didn't recognize them, but my son did. So it was kind of a neat experience. Made our little trip to LA kind of unusual, interesting. But it's because of these young starlets that young people look up to, the social media, that I think is propelling more and more young people to get the fillers for the fuller lips and the Botox. And another thing is these special deals that people get on Groupon. It seems every time you turn around, you get a Groupon email, hey, get your Botox, you know, $8 a unit, and your filler half off, buy one, get the second one half. So these are all propelling more and more people to utilize these. But I think at the end of the day, what's really, really important, and the one caveat I would tell people, be very, very careful in selecting a plastic surgeon. You know, you really have to do your homework now more than ever before. So certainly be cautious, be wise, and seek out the best advice and get the best care possible. Again, I want to say thanks for tuning in. Hope you found this informative. We look forward to hopefully entertain you again or give you some more updates on what's coming down the pike. If you want to come in for a consultation, the consultation is free. You can go to my website, Beauty by Brueck. You can call my office at 239-244-2329. I also have an office in Punta Gorda, Cape Coral, and the main office here in Fort Myers. So again, I want to say thanks. Wish you all a wonderful week. The richest of God's blessings to you and your family. We look forward to seeing you. Take care and God bless. Bye-bye.